The Health and Human Services Department today created a new division within its Office of Civil Rights, the Conscience and Religious Freedom section. And this new section within HHS is going to take complaints from healthcare workers who feel that they are being forced to provide services or do things that are contrary to their moral or religious convictions. So if you talk to administration officials or, for example, a number of conservative activists, particularly those who oppose abortion, what they would say is this is the federal government enforcing more strictly existing laws that are aimed at protecting individuals or institutions that don't want to provide services, particularly abortion and sterilization, against their wishes. When you look at critics of this policy, which include, for example, some women's rights groups, as well as those representing lesbian, gay, bisexual, transgender, and queer Americans, they would say that this is going to encourage individuals who might want to discriminate against folks. Going forward, it'll be fascinating to see how the administration acts on this new initiative. There still could be regulations that we don't see, so that's one thing that we'll be looking at. And also, when they were announcing it, they said that it's clear that because people know a new administration is in charge, they're coming forward with more complaints. So, for example, there were 34 complaints, officials said, just since Trump took office, compared to something like 10 complaints during all of Obama's 2 terms. So I think what's interesting is there's an interesting dynamic where the Trump administration is sending the message that they're open for business in terms of taking up these religious liberty claims, and then you're seeing a response from people who feel like they haven't been heard under the past administration, and that may prove to be a very powerful driver of policy going forward.